Well, tonight, Mississippi's top doctor says his state's hospital system is on the verge of a total collapse. New cases and hospitalizations going up so fast, the state is about to have 2 field hospitals operating out of a parking garage in Jackson and is being asked to approve a 3rd field hospital in DeSoto County. Rebecca Butcher breaks down the newest information.
We're clearly at the worst part of the pandemic that we've seen throughout, and it's continuing to worsen.
Mississippi State Health Officer Dr. Thomas Dobbs says the state is seeing a higher number of hospitalizations and COVID-19 cases. Over 1,600 people are hospitalized with COVID in Mississippi, which is higher than in January of this year.
Like we've seen before, sadly, additional deaths are going to follow. Without a doubt, we have surpassed our previous peaks by a substantial margin.
Currently, 89% of hospitalizations, 86% of COVID deaths, and 98% of cases are those who are unvaccinated or partially vaccinated. The solution, doctors say, a shot in the arm.
We know that people are surviving at much higher rates if they have the vaccine and they get COVID.
There are a growing number of youth cases and hospitalizations of those under 50, which Dobbs says is not surprising. Over 20,000 children are in quarantine because of the coronavirus in Mississippi since school began. Meanwhile, in DeSoto County, the state approved a testing facility set to be set up next week, and health leaders also say they're reviewing a request for a possible field hospital.
We are aware of a request from DeSoto County. We've been visiting with their leadership there, as well as their emergency management team up there, trying to identify some potential ways to bring some additional resources.
Director of Health Protection Jim Craig says equipment, staffing, and beds also need to be taken into consideration for the field hospital. In DeSoto County, Mississippi, I'm Rebecca Butcher.